Dr. Bell, thanks for joining us here on Health Connection. Our topic is dementia, the different types of dementia, because we use it as one word, but that's a catch-all. And so I want to ask a question. What is dementia? Why is the term often used interchangeably with Alzheimer's?
Well, dementia is actually a group of illnesses, all of which result in progressive decline or damage to areas of the brain that support higher intellectual functions, that is, reasoning, perception, acquiring new memories, or learning new materials. So they all have that in common, but the underlying mechanisms or the causes of that damage in the areas of brain tissue that are affected vary depending upon the types. Alzheimer's, I think the reason it's thought of interchangeably with dementia is that it's far and away the most common of those. It's over half, in some groups, much more than half of the causes of dementia. But there are a number of other illnesses and conditions that can cause dementia also.
Well, let's a nice segue. How many different types of dementia are there, and how are they different?
Oh, there are at least 5 or 6 major or different causes. As I mentioned, Alzheimer's is far and away the most common, over half. Probably the second most common is what's called vascular dementia, which is caused by multiple, usually small strokes in the brain. That's something people are more familiar with. That can cause acute or sudden loss of function of an arm and a leg on the same side, or speech, but multiple small strokes can also cause dementia syndrome. And then there are multiple other less common causes. There's one called Lewy body dementia. There's another called frontotemporal dementia. There's another one called normal pressure hydrocephalus. And in each case, and there are other even less common causes of dementia, but in each case it's a different mechanism that causes the brain damage, but the end result is much the same, although the symptoms at the onset of illness can be different.
You just touched on this, and I could tell from what you just said there's no one answer to this question, but let's try it. What causes dementia?
There are a variety of different processes, but it's usually a process that damages brain cells, the brain cells that support higher intellectual functioning, and ultimately over time kills more and more brain cells, and then results in the symptoms we see in dementia. So the underlying causes are at the microscopic level. In the instance of in some instances, this is pretty well worked out by medical science. And in other instances, there's a lot more research we need to do. For Alzheimer's disease, for instance, our current thinking, and there's stronger and stronger evidence that this is actually what happens. It's an accumulation over many years of a material called amyloid that slowly causes progressive damage and death of brain cells and leads to the symptoms we see in Alzheimer's disease.
What are the most common signs and symptoms of dementia, and how do you distinguish it from the normal forgetfulness we kind of associate with aging?
Well, I think that's one of the most common issues that we have to deal with as physicians or any other health professional that's seeing patients with dementia. I think the most common problem that patients come in with dementia is progressive forgetfulness, or inability to retain new memories or new experiences. But we've got to keep in mind that that's only one part of higher intellectual or brain function, and there are other common symptoms or area of symptoms as well. Another common area, for instance, is speech, progressive difficulty with verbalizing or speech. It can be difficulty perceiving or understanding the difference between different types of shapes. And then another common set of symptoms is what we call executive function in the brain. That's what allows us to organize and plan activities, and that can be pretty subtle. And sometimes it takes a while to appreciate that's declining. Now, all of us, or many of us anyway, as we get older, do find it a little more difficult to retain new information. I think we've all experienced that. You know, if we go take a calculus class when we're in our 70s, we're going to have more trouble than if we take it when we're in our 20s. So that's normal. But when it gets beyond that, and people start having trouble with performing tasks they could previously perform well, then that's more worrisome. In other words, it's not abnormal as you get older to maybe forget where you put the kitchen knife, but it's definitely abnormal when all of a sudden somebody's having trouble setting a microwave oven. It's not abnormal to maybe forget a little more easily where you put your keys, but it's definitely abnormal to all of a sudden, or not all of a sudden, over time, begin to have trouble with operating your automobile, using the audio system, things like that. So those are tip-offs that it's gone from just what we call benign forgetfulness, or a little more forgetfulness as we get older, to the point where we're actually having trouble in our daily life doing things that we previously could do.
You just mentioned tip-off. Do patients themselves sometimes recognize the early signs of dementia?
Sometimes, but more commonly, at least in my practice and in my experience, it's a family member, either close family members or close friends, that notice that somebody that was previously functioning very well or working at a high level of function is declining. And what I see more often is family or close friends saying, no, this is really significant, and the patient themselves having a little more difficult time recognizing that. So when I see patients in my office, they seldom come in by themselves complaining of more memory problems. They usually come in with family or friends who give history that makes it a little more difficult, a little more easy to assess whether it's a significant problem or not.
Is the disease increasing, or do more people have dementia, or is it simply a function of the fact that the population is living longer?
I think it's primarily a function of the fact that the population's living longer. I'm a baby boomer. I suspect you are too. There are a lot of us, and so the demographics of the population is we're all getting older, and up to 1 out of 3 patients in the age groups 80 to 90 have a dementia syndrome of one type or another, most commonly Alzheimer's disease. So that's inevitably that's going to result in a very large and increasing number of patients with this diagnosis.
The current medications only seem to delay the progression for a short time. Why are there no medications on the market for actually treating and doing away or beating back the disease?
Yeah, this is one of the biggest challenges for healthcare in our time. And the reason is because the brain damage that we see manifested as symptoms in patients when they come into offices at age 70 to 80 actually starts probably 10 or 20 years, or maybe even longer than that, earlier than that. So what we're seeing by the time patients have symptoms is kind of the end result, a brain that's already severely damaged. And so at that point, in most instances, not all instances, but in most instances, it's really too late to interrupt the disease process. So the best we can do is prescribe medications that, as you pointed out, treat symptoms and are only effective for a relatively brief period of time. To really get a grip on this condition and to treat it effectively, We need to develop new diagnostic tests and new treatments that we can start much early on, 10 or 20 years before symptoms develop, where we can interrupt the causes that actually result in the brain damage and then the symptoms. It's very analogous to treating cholesterol for heart disease. If we can put patients on cholesterol medications after they have their first heart attack, and that's effective for a time, but it's much more effective if we can start treating patients before they develop serious vascular disease and prevent that from ever occurring.
Well, so you brought it up. Is there anything that can be done prophylactically with respect to dementia?
Some things. There's some pretty exciting new research in the value of regular aerobic exercise and that it may reduce the risk or the frequency of dementia as we get older. Also, of course, that's good for many other things. It reduces the risk of a heart attack and stroke also. There's some early information that certain diets or dietary patterns also reduce the risk of dementia, the so-called Mediterranean diet. There's some early information there. So there's some lifestyle measures that can reduce the risk of dementia. Particularly, one of the most common causes of dementia is vascular dementia, multiple small strokes in the brain, and we know how to prevent that. That's good control of hypertension, good control of cholesterol, the lifestyle measures I mentioned earlier. So there's some things right now that are effective to reduce the causes of dementia. Long term, we still got some medical science and medical study that we need to perform to start identifying patients early on that are at risk, particularly for Alzheimer's disease. And there is some new information and new studies coming along. We really don't, other than the things I just talked about, we don't have a single pill or drug or therapy that can greatly reduce the risk for Alzheimer's disease. But I'm hopeful we're gonna get there.
Is there a genetic component to dementia?
Yes, there are. There's a gene called ApoE, and when you have a certain genetic pattern with that greatly increases the risk of dementia. And there's some other genetic components as well. So it's like many illnesses. There's a genetic component to it, and then there's a lifestyle component to it, and then perhaps even exposures that environmental exposures that we don't know about. So in the majority of people, it's not solely a genetic disease, but there's a genetic component or risk to it.
You touched on this a moment ago. Any new treatments on the horizon that show promise?
Nothing really yet. There are drugs, and we've started to develop brain imaging studies that, for instance, identify this amyloid buildup in brains at an earlier age, 10 or 20 years before. And so we're starting to look at medications that can reduce or interrupt that buildup and the damage it causes, but these are all in the investigational or experimental phase right now. So there's no drug that's been released that's effective at an early stage to prevent Alzheimer's disease, but there's a lot of research ongoing, and I think we're starting to understand more and more about the underlying causes of these illnesses. So hopefully we will identify therapy. Now, there are some causes of dementia. There's one called normal pressure hydrocephalus that's an accumulation of fluid within the brain, and that's entirely reversible. If it's identified early on, you can get a procedure called a shunt procedure just to release the fluid pressure of that buildup that can dramatically reverse that dementia. And then there are other causes of brain function decline, also say trauma where you get a buildup of a clot on the surface of the brain that can be reversed by a surgical procedure too. So it's vitally important for patients that where either the patient themselves or loved ones think they may have dementia to get in and get that evaluated because on occasion there are things that can be done that can have result in dramatic improvement in a quick period of time.
You mentioned family members and loved ones. If a family member, a spouse, suspects their loved one might be suffering the early symptoms of dementia, what should he or she do?
Well, I think one, of course, I think they should take their loved one, coax them sometimes in to see their physician. There's a relatively simple battery of tests, some blood tests, usually a brain imaging study that can be done to identify some of these types of dementia that can be treated effectively and in some cases with dramatic results. I think before the doctor's visit, I think the local Alzheimer's Alliance, which anybody can look up in the phone book or on the internet, can be invaluable. They can help family members and patients understand whether this is just what we call benign forgetfulness or whether it might be a more serious problem and they need to get right in to see their physician. So I think that's another good resource for people. But I think the key is if there's enough of a concern, if this is a new change that's getting steadily worse, and particularly if it's starting to interfere with the ability to perform daily functions that previously somebody could do without a problem, that's a warning sign. It could be a serious problem and they need to get in and get evaluated.
We hear mind exercises, diet exercise, you've mentioned these things, all can delay or prevent developing dementia. Is there truth to this? Is there truth to adopting these lifestyle changes to fight this disease?
I think there is. I think the science is incomplete on it and we've got to do more research studies. But the verdict's really in, for instance, on regular aerobic exercise. 150 minutes of moderate intensity exercise, that's where you exercise just enough to get a little breathless but not exhausted. If you can do that 30 minutes 5 times a week, and you don't have to be training for a marathon or mountain climbing. This can be moderate exercise that anybody can do. That may reduce the risk of dementia and certainly has benefits and reduction of heart attack and stroke. The science behind the Mediterranean style of eating or diet's really pretty good for reducing the risk of heart attack, and it may also reduce the risk of dementia. The science behind mind exercises is a little less strong, I think, but I think still, I think that's bound to be at least somewhat beneficial. And I don't think and more importantly, there's no downside to doing any of these things. They're all potentially beneficial. Science is getting better to supporting them, and they're definitely not going to hurt, and most likely will help.
Doctor, thank you very much.
It's been my pleasure. I enjoyed the conversation.